Hi, I'm Dr. Vivek Shashindran and welcome to yet another episode of ENT Talks. So the past few months we have been talking about certain common ENT conditions, some of the ENT surgeries, and in fact we have received quite a few queries regarding some of these topics. So in this episode I would be clarifying some of these queries, and today we would be going back to the topic cochlear implantation. In fact, we have done quite a detailed description of cochlear implantation, the candidacy, the kind of patients or the type of hearing loss that we deal with, the age at which you can implant, the complications associated with this procedure, and even we have touched upon the entire device, that is cochlear implant, in detail. However, some of the common questions that have come up. Now, there were some queries regarding the cost of implantation in India. Now, the cost of a cochlear implant, the device per se, the basic model would cost somewhere around between 6.5 to 7 lakhs. The upper limit could go up to around 18 lakhs per implant. Now, do we have any kind of financial assistance? So this is the most commonly asked questions. Yes, in Kerala we have a state-run program, that is Sruthi Tharangam, where the government supports unilateral hearing implant. Now, apart from that, we also provide financial assistance to people from the BPL category and people from financially backward socioeconomic status. So these are done with the help of NGOs, so wherein we can actually take care of the implant, where the patient is provided the cochlear implant free of cost. Now, the second query is there any kind of difference in the implant that is provided through these schemes? Well, we only use FDA approved implants, that is a Food and Drug Administration Authority. So they have approved certain implants, and these are the only implants which we offer our patients and which are being offered through these schemes. The companies, the implants that we commonly use are from Advanced Bionics, Cochlear and Medal. So you get support for these devices all over the globe. These implants, the service, the accessories, these are available everywhere. So there is no difference in the quality of implants that are provided through these schemes. Thank you.